Okay, let's talk about something that's honestly pretty shocking. The United States, one of the wealthiest nations on Earth, is also the most dangerous developed country to give birth in. In this explainer, we're going to dig into why this is happening and how a really painful history is still shaping what happens to mothers today.
So, to really get a handle on this, you first have to understand that we're basically looking at a tale of two completely different worlds when it comes to childbirth. And seeing that contrast is absolutely key.
So, if you look at most high income countries, right, the chance of a mother dying from anything related to her pregnancy is tiny. We're talking about 1 in 4,900. It's what you'd expect with modern medicine and good healthcare. And then you have the United States. And it's not just a little worse, it's a massive, tragic outlier. The risk for mothers here is way higher than any other wealthy nation. It's a statistic that just shouldn't exist. It doesn't make any sense. And here's where it gets even more complicated. Inside the US, this isn't a crisis that everyone feels the same way. The differences along racial lines are just huge. Look at the 2021 data. For every 100,000 births, the death rate for white mothers was about 27. For Hispanic mothers, about 28. But for Black mothers, that number just explodes to almost 70. Just let that sink in for a second. Even when you control for things like how much money you make or how much education you have, a Black woman in America is still almost 3 times more likely to die from a pregnancy-related cause than a white woman. It's a huge, persistent gap, and it demands an explanation. So, yeah, this all leads to the big question, the one we're really going to unpack here. This isn't just about statistics. It's about getting to the root of why they look this way. And the answer, maybe surprisingly, isn't just about what's happening in hospitals today. No, to really understand this, we have to go back, way back, because the answer is buried in our history. Yeah, believe it or not, the roots of this crisis go all the way back to slavery, and what happened then is still casting a long, dark shadow over exam rooms today.
You have to understand this wasn't about science. Not at all. Back in the 18th and 19th centuries, there's this whole story being built piece by piece to justify slavery. It started with people like Thomas Jefferson suggesting there are biological differences. Then it was put into horrific practice by doctors like J. Marion Sims, who performed surgeries on enslaved women without anesthesia. And then it was all written down as fact by men like Dr. Samuel Cartwright, who literally made up diseases to claim Black people were fundamentally different.
And get this wasn't some crackpot idea whispered in a corner. This quote, it was published in a respected medical report. It was presented as scientific fact, creating the medical excuse for treating people inhumanely, based on the lie that they didn't feel pain the same way. So from that rotten foundation, you get all these medical facts being taught, that Black people have thicker skin, that their nerves are less sensitive, that Black women are just tougher during childbirth and don't feel as much pain. These weren't just innocent mistakes. They were ideas created to justify brutality. Now you'd think, okay, that was the 19th century. We've moved on, right? Wrong. These ideas are incredibly sticky, and they are still doing real harm in medicine today. Today, we have a name for the ghost of these old myths: implicit bias. These are the unconscious stereotypes that can shape how a doctor thinks and acts, even if that doctor would tell you, hand on heart, that they aren't prejudiced at all. It's the past, sitting right there in the exam room. And if you think I'm being dramatic, check this out. A really important study in 2016 from the University of Virginia found something just unbelievable. A full half of the white medical students and residents they surveyed still endorsed at least one of those old, totally false biological beliefs about Black patients. And this isn't just some abstract belief. It has real-world consequences. That same study found that the trainees who believed these myths, they consistently rated Black patients' pain as being less severe. And because of that, they made less accurate recommendations for how to treat it. And this is what that looks like in a hospital today. Black women are more likely to need a C-section, and they report the worst pain after that surgery. But they're checked on for that pain less often. And they're given less pain medicine than white mothers are. You can draw a straight line from a historical lie to modern-day medical neglect.
Okay, so let's pull back for a second, because this isn't just about what's happening in one doctor's head. It's about a whole system that's missing the basic safety nets that other countries take for granted.
I mean, just look at this comparison. It's night and day. The US doesn't have universal health care, unlike its peers. Midwives, we have a tiny fraction of what other countries have. And those things that seem like no-brainers, like a nurse visiting you at home after you have a baby or getting paid maternity leave, that's standard practice almost everywhere else. Not here.
And that postpartum piece, the support after the baby is born, is so critical. Why? Because in the US, about 2/3 of maternal deaths don't even happen during delivery. They happen in the weeks and months that follow, a time when moms in the US are often left completely on their own.
So what do we do? Well, the experts are pretty clear on what needs to happen. We need to actually use and integrate midwives into our system. We need to make sure insurance coverage doesn't just disappear right after birth. And we need to guarantee that every new mom gets real support, like home visits. Honestly, these aren't radical ideas. This is just the standard of care in most of the developed world. So it all comes back to this really tough question, right? How do you fix a system that was, in many ways, built on pain? The point of looking at this history isn't to point fingers. It's to understand where the rot started, because it's only by facing those painful origins head-on that we can even begin to build a new system, one that's fair, safe, and actually supports every single mother.